Hi, I'm Dr. Rengi, board-certified endocrinologist, and I practice in Sacramento, California. Today's topic is osteoporosis. Osteoporosis is defined as a disorder of the skeleton system where there is microarchitectural deterioration of the bones, increasing the risk of fractures. It's a very common condition. It's expected 1 in 2 women above the age of 50 and 1 in 4 men above the age of 50 can have fracture in their lifetime. There's estimated about 54 million people in the United States who have osteoporosis or osteopenia or decreased bone mass, which increases or puts them at a high risk for fractures. Not only is it a very common condition, it's a very expensive condition as well. It's expected by 2025 we'll have estimated 3 million fractures in a year, cost of which is going to be exceeding close to $25 billion. Because of that, and also because of personal repercussions of having high fracture risk, it's important to treat this condition. Now, first of all, what happens if you have fracture? Fractures increase your risk of having complications from the fractures. Depending on your age, you could be either at a high risk for wrist fracture that happens usually in younger age, relatively right after menopause, followed by vertebral fractures, followed by hip fracture risk. Once you have a hip fracture, the risk of dying within the same year is a lot more compared to your peers who do not have hip fracture. The other problem that can happen is after a fracture, depending on the location, you have increased pain or chronic pain. There's also stooping, change in the posture that can affect patient's personality. There's also decrease in lung capacity because of loss of height, and that can affect breathing disorders and having problem or maybe complicating underlying other medical conditions. Not only that, it can also lead to isolation and depression because of less mobility. Having said all this, that makes us very concerned about the condition, and we want to make sure we identify the patients who are at a higher risk and take care of their nutrition, take care of their lifestyle, and prevent either developing osteoporosis or if they have osteoporosis, then developing fractures. Lifestyle has a very important role in preventing bone loss or bone strength. Smokers have accelerated bone loss. Excessive alcohol drinking decreases our bone loss, our bone mass. People who are on certain medications like steroids or glucocorticoids are at a high risk for bone loss as well. Somebody who's getting prednisone more than 5 milligrams a day for more than 3 months is at a high risk for fractures. Certain conditions can increase your risk of fractures as well. For example, if somebody has overactive thyroid, that makes your bones weaker. Somebody who has overactive parathyroid, where the calcium balance is lost, that can increase your risk of fractures. Also, if somebody is having excessive excretion of calcium in the urine, that can lead to more calcium loss and making the bones fragile. So these are all the reversible and irreversible causes that we are talking about, and hence, if we can identify these patients, then taking care of their bones from earlier on, preventing bone loss is our priority. Also, you got to have adequate amount of calcium and vitamin D supplementation. We recommend taking not more than 1,200 to 1,500 milligram calcium a day, out of which more than 50% of this should be dietary calcium. Vitamin D supplementation depends on your level of vitamin D. If somebody's vitamin D level is more than 30, then we recommend close to 800 international units of vitamin D a day. If somebody's vitamin D is lesser than 30, then usually we recommend giving a therapeutic prescription vitamin D for a certain amount of time, and once they have adequate vitamin D, then we can switch it to over-the-counter vitamin D. Regular exercise helps prevent bone loss. We recommend having at least 2.5 hours a week of activity. So if you're not getting adequate exercise, and especially during COVID, if you're sitting a lot more and not moving, that is not helping your bones. We highly encourage you to have more activity. Try to match it up to close to 2.5 hours in a day, in a week. Now, bones always remodel. There's bone formation and there's bone resorption. This bone formation and resorption is a very coupled cycle that happens at a very regular rate until the age of 25 or 30. That's when we achieve the maximum bone mass After 25 to 30 years of age, there's more bone resorption and less bone formation. Bone forming cells are called osteoblasts. Bone resorption cells are called osteoclasts. So once you stop making more bone mass, that peak bone mass is going to be lost over time. And if there's any factors that increase that loss, then your fracture risk is going to go high. Now, once we've identified people who have high risk for osteoporosis, then it's time to get bone density. Once the bone density confirms that their BMD or bone mineral density is below the threshold of treatment, then we should consider treatment. What are the different treatment options available? There are oral medications called oral bisphosphonates. Those are primarily given earlier on in the stage of the condition for both prevention and treatment. The common side effect of those medications called oral bisphosphonates, among which we have Fosamax, Actonel, Boniva, they all have tendency to cause heartburn. So if somebody's taking those medications and they get worsening of heartburn or start of heartburn, which is difficult to tolerate, then they're not good candidates for oral bisphosphonates. Also, oral bisphosphonates can have side effect of osteonecrosis of the jaw. Therefore, we recommend you to have good dental hygiene and see your dentist regularly. Other important medication information is only 1% of the pill gets absorbed. So whenever you are given oral medications for osteoporosis, you got to take them very religiously and with a cup of water, not to lay down, and staying upright for at least an hour, and no food for 1 hour. Once you do this regularly, then you should have a repeat bone density 2 years after. And if the bone density is maintained, we continue these medications at least for a couple years or 4 to 5 years before we take a break from the medication because of long-term side effect concerns. This is not a recommendation for individual patient. You must discuss with your doctor regarding your treatment plan. However, this is something that you need to understand. The other treatment options are injectables, and these injectable medications could be either reclassed or zoledronic acid or zoledronate, or denosumab or Prolia. So denosumab or Prolia is an injectable medication which is given in the upper arm. It could be done at your doctor's office, has to be done every 6 months. It's relatively safe on your kidneys, and it can cause pretty significant fracture prevention. However, there can be a loss of bone density pretty fast once you stop it. Therefore, if you're taking Prolia and you stop the medication, you must have a discussion with your doctor regarding a follow-up treatment in case you're planning to stop. There have been some case reports of worsening of vertebral fractures after the patient stopped suddenly. The other side effect that can happen with both zoledronic acid and with denosumab is osteonecrosis of the jaw. Now, that is not a common condition. It's a very rare condition, can happen among people who have either poor oral hygiene, or they have ongoing infections, or they have any kind of hardware put in which has not been kept well in regards to hygiene. Therefore, a regular dental visit is must, and also you must get dental cleaning every 6 months. At the earliest sign of any pain in the jaw, you must see your doctor. Most of the people have more benefit than the risk of the condition, therefore treatment is justified. But if you are at a high risk for the side effects, then you must have that discussion with your doctor. There are other class of medications as well that are given every day as an injectable form, which have much higher benefit, and those are given for a treatment period of 18 to 24 months. Again, somebody who has failed on the oral therapy or somebody who's not responding to the earlier treatment options, then it's a good time to switch them to this daily injections, or somebody who has had multiple fractures who needs a stronger protection, then also we consider this. There's side effects of every medication, so please take it with the advice of your doctor. This is just general information. Hope this video was informational for you. If there's any questions, we'll be happy to answer to our patients. 530-677-0700. We highly encourage you to live your life to full potential. Try to avoid falls, try to have good body posture, exercise regularly, have good dairy intake, and have a good calcium in your diet, and stay healthy. Good luck.